Today I want to talk to you about one of the most powerful combinations in facial rejuvenation, the facelift and neck lift combo, and why, for the right patient, these two procedures often work better together than doing either one alone. This is a common question I get in consultations. Patients will say, I think I need a facelift, or I hate my neck. Do I just need a neck lift? And sometimes they're not sure what procedure will actually give them the result they're hoping for. So let's break it down in a very simple way. The lower face and neck don't age separately. They age as a connected system. The jawline blends into the neck. The skin and soft tissues in that entire area change over time. So when you treat only one area, you can sometimes end up with an unbalanced result, where one area looks improved, but the other area still shows aging. Let's talk about what aging looks like in this region. In the lower face, patients start to notice jowls. The jawline becomes less refined or defined. The corners of the mouth may start to pull downward slightly. The lower cheeks can look heavier, and that's because the soft tissues that used to sit higher in the face gradually descend. In the neck, patients often notice loose skin, fullness under the chin, or vertical bands. Some people call it the turkey neck. Others say they hate the profile view or how the neck looks in photos. Now here's the key point. These changes usually happen together. When the jawline becomes less defined, it often blends into the neck laxity. And when the neck becomes looser, it makes the jawline look even less sharp. So if we correct one area but not the other, the overall result can feel incomplete. For example, if someone has a facelift that improves the jowls but doesn't address the neck, they may still have loose skin or banding in the neck that makes them feel like they still look older than what they want. They may say, my face looks better, but my neck still bothers me. On the other hand, if someone tightens the neck but leaves the jowls, the neck may look improved, but the jawline still looks heavy. That can create a situation where the neck looks tighter, but the lower face still shows aging. And the patients often feel like the improvement wasn't as dramatic as they hoped. That's why combining a facelift with a neck lift often creates a much more harmonious result. It restores the jawline and the neck together, so the entire lower third of the face looks refreshed. Now, I want to address a very common concern. When patients hear facelift and neck lift together, they sometimes worry that it sounds extreme. They'll say, I don't want to look pulled, or I don't want to look like I've had work done. And I completely understand that. Nobody wants an unnatural result. And a natural facelift and neck lift combination is not about pulling the skin tight. That's old school thinking. Modern techniques focus on repositioning deeper structures and then laying the skin back smoothly without tension. The goal is to restore youthful contours, not to stretch the face. So what does the combo actually improve? It improves the jawline definition, it reduces jowling, it restores a cleaner transition between the face and the neck, it tightens loose skin on the neck, it can improve neck banding depending on the anatomy, and it can create a sharper, more youthful angle under the chin. And the reason patients love the combination is because it often gives them that complete rejuvenation look. They look in the mirror and they feel like their whole lower face looks younger, not just one area. Now, does everyone need both? No, not every patient needs a facelift and a neck lift together. Some patients have a relatively youthful face but a neck that is aging faster. In those cases, a neck lift alone might be enough. Other patients have early jowling but a neck that still looks good, and a mini facelift might be appropriate. But for many patients, especially those who have both jowls and neck laxity, the combination is what gives the best overall result. So how do we decide in the consultation? I evaluate your whole lower face and your neck together. I look at the degree of jowling, the skin laxity, the position of the cheek tissues, and the neck anatomy, meaning the skin, fat, and muscle banding. I also talk with you about your goals. Are you looking for a subtle refresh, or do you want a more dramatic jawline? Do you want the longest lasting result possible? Do you want to avoid looking overdone? These are all important considerations. Let's briefly talk about recovery, because that's a very important part of the decision. When you combine a facelift, and neck lift, you should expect swelling and bruising, especially in the first couple of weeks. Most patients start to feel socially presentable within 2 to 3 weeks, depending on their healing. But the refinement continues for weeks after that as swelling settles and tissues soften. The result becomes more natural over time, and that's when patients really love the outcome. So here's the takeaway. The facelift and neck lift combo works better together because it restores the entire lower face and neck as one unit. It creates a more balanced, natural look. It avoids the half-done look. And when performed with modern technique, it should never look pulled. It should look like you just got younger and more refreshed. If you're considering facial rejuvenation, you're not sure whether you need a facelift, a neck lift, or both, the best next step is a consultation. We'll evaluate your anatomy, discuss your goals, and create a plan that gives you the most natural and beautiful result. So call us at 518-583-4019 or go to SaratogaSpringsPlasticSurgery.com.